Okay, well, welcome everybody. Thank you so much for being here today. My name is Amy Herrera. I'm a regional coordinating director for GMaP Region 3, and I'm here with my associate, Emily Kay, my colleague from Region 6, and we are very happy to be hosting this webinar today. So as you can see, the GMaP program is the Geographic Management of Cancer Health Disparities. And this is a national program. So we have 6 different regions, and each region has a hub where they're based out of. And you can see on this map, the little white ticks are where the hubs are around the country. And we have regions including all the continental United States, Alaska, Hawaii, Guam, American Samoa, and Puerto Rico. Emily, you want to talk a little bit about what GMaP does?
Sorry, on mute.
Oh, that's okay.
So GMaP supports cancer health disparities research, as well as recruitment and career development of underrepresented cancer researchers. As a program, it provides networking, professional training and development, as well as communication and information dissemination. Yeah, feel free to add anything that I've left out, Amy. So GMaP partners with NCI's Center to Reduce Cancer Health Disparities to support the CURE program. CURE offers unique training and career development opportunities to enhance and increase diversity in the cancer research workforce. The CURE program identifies promising candidates from high school through junior investigator levels and provides them with a continuum of competitive funding opportunities. So if you're not familiar with CURE, I would definitely recommend looking into all of the different funding mechanisms that they provide and that you may be qualified for.
Okay, so each of our regions is a little bit different in what we offer, although we have a lot of similarities. So for Region 3, we offer, I'll just start at the top. We have those grant writing resources like this training we're doing today, also mock reviews. And then we have our monthly e-newsletter that comes out. If you're not signed up for that, you can go to our website and get signed up pretty easily. And that is going to include all kinds of information, including jobs, all the trainings and workshops that we and our partners sponsor, and then lots of funding opportunities. We also have travel scholarships, which are up to $2,000 right now that can go toward your travel expenses and conference registration if you are doing something to do with cancer health disparities. We support people taking their posters and abstracts or even just attending to network. So we also have mentorship opportunities. We do pair people with mentors and mentees. We also have a website where we often feature a scholar. You can find out what some of your colleagues and researchers are doing, what projects they have going on. And we also have some social media. We're on Twitter. You can search, and I'll show you on the last slide exactly what you can search for. And then in LinkedIn, we have a group. And if you want to join that group, it's the quickest and easiest way to get updates in between the monthly newsletter. We also just have an extensive network of cancer and cancer health disparities experts. And then, of course, we do work with our members and encourage them to get those NCI funding mechanisms, so the F, K, and R series awards. And I'll let Emily talk a little bit about Region 6.
Perfect. So Region 6 has a lot of the same offerings. So if Amy mentioned something that you're interested in and you're in my region, feel free to reach out. You can see I've written a bunch of the programs that we have up on the slide. One of the things that we are also really pushing right now is our travel support. So if you are attending a conference in the fall and would like a stipend to attend, please reach out. I'm also hoping to take the opportunity to promote our upcoming mentor-mentee training that we have, which provides a framework for enhancing mentorship, either whether you're a mentor or a mentee. It can help enhance those skills on either side. It's a 5-week series that begins in September, and it's completely free. The training often comes with a pretty steep registration fee. So if you're interested and want to take this training with my region, it is open to all GMaP regions. So just reach out to me. I can provide more information. Yep. Those are some of the things that we can provide.
Okay, and that's our very brief introduction of GMaP, who we are, kind of what we do. Hope that gives you sort of an idea. Here's a couple examples of what our websites look like, and just a list there of where you can find us online. We have those Twitter's hashtags, and then the LinkedIn group, and of course, my email and Emily's email. I'm going to get out of this.
Did we want to take the opportunity to have everyone introduce themselves in the chat? And if you're working currently with a GMaP region, maybe you could mention that as well if you're partnering with us.
Yeah, we can definitely have people do that. I just want to introduce our speaker today. And then, yeah, if everybody could kind of introduce yourself in the chat, just who you are, where you're from, we would love to hear from you. So today we have Dr. Jill Kaar. She is an associate professor in endocrinology in the Department of Pediatrics at the University of Colorado School of Medicine. As a behavioral epidemiologist, Dr. Kaar studies how health behaviors like sleep, diet, and activity impact the health, like obesity, type 2 diabetes, early risk factors for cardiovascular disease, and the well-being of children and adolescents. She uses observational methods via both quantitative and qualitative methodologies to first identify key associations with health behaviors and disease risk, and then uses those findings to guide intervention strategies with potential for widespread dissemination and implementation. At this time, she is principal investigator for 3 active intervention protocols that use both clinical and school-based designs to change behaviors of children and adolescents. All active protocols are focused on improving mental and/or physical health of pediatric populations. So that's a little bit about Dr. Kaar, and I will hand it over to her.
Hello, everyone. So I'm seeing some things in the chat. We have some people from Oregon, New Mexico, San Antonio. Where else? I'm coming in from Boulder, Colorado. So the other thing, if you go ahead and type that in the chat. And the other thing, just to get us started, just so we kind of understand who's in our audience, I'm going to ask you 2 questions. First, well, tell me 3 questions. Tell me where you're coming from. And if you're on vacation, you can tell me that location as well. Okay, the second question, how many grants have you submitted? Let's see them. Is nothing coming in? Come on. This should be interactive. Yeah, whatever. Everything counts. Any grant. There we go. Okay, KO1, that's a big City of Hope. Okay, very nice. So I'm not seeing a lot of responses besides that KO1. So does that mean that the bulk of you a pilot award? Okay, 1 fellowship. Thank you. Okay, good. This helps me frame what I'm gonna, how I'm going to teach today. I've submitted, I don't know, somewhere between 40 and 50 grants. So the other thing I was gonna ask, my next question, what percentage of those that submitted grants, a KO1, okay, have you actually been funded? So what percentage, if you submit 5 grants, how many have been funded? What percentage? My number's super low. I don't know what the percentage is. I'd have to do that calculation, but it's very low. All right. Okay, so fellowships, this is really going to be a 101 talk, and that's really good because that's how I prepared it. Hi from Hawaii. Philly, 5 grants. Okay, 20%. That is a high number. All right. Jennifer, next year you're probably going to teach this course. That's awesome. Oh, okay. 2 grants and 100%. Wow. Okay. Well done. Okay. Well, thanks for sharing that with me. I just want to make sure that when I'm explaining things that I'm coming at the right level of your backgrounds. For this talk, please, we're monitoring the chat. I will do my best to monitor it, but Amy's going to help me out and interrupt me. Please interrupt me, because I feel that when the momentum's going and we're going through these different topics, if you have a question, just toss it in the chat, interrupt me, raise your hand, whatever, just get my attention, and we'll pick right back up. And then about halfway through, I do have a 5-minute break, so know that that's coming. And the last thing I wanted regarding housekeeping is there is a PDF of all of these slides, so you don't have to worry. They're in your, they should be in your email box. All right, let's get started. Okay, so the 2 takeaways from today, and I'm going to have to move some things around 1 second. Okay, I'm going to first start with how to write a winning grant proposal. And the second thing, how to complete the grant when awarded, because that's super important too. So I didn't want to miss that. Okay, I'm gonna have to lose Amy. I'm losing the chat box because it keeps covering things up. Okay, okay, thank you. Okay, so the steps to writing a grant proposal, I'm just gonna identify, or I've kind of broken everything down into sections. There are 6 topics that I'm gonna talk about. So just the importance of getting a system in place, ask for funded grants. So there's lots of people that have written grants for similar foundations or KO1s or fellowship grants, and you want to grab hold of all of those. Learn about your funder. We're going to talk about that AIMS page. Then we're going to also note some potential problems and solutions that I want you to keep in your mind when you're writing a grant. And then we're going to talk very quickly about paying attention to detail. And if I don't, and also when we're going through, take notes of things if I'm not mentioning them and you have questions, and then we'll have some time at the end as well for a discussion. All right, develop a system. You are gonna write a lot of grants and you have to commit. It's a game, it's a full-time job. It's not something you can just do on the side, unfortunately. And it really comes down to luck. In my grants that I've submitted as I've continued working through my career, I have very rarely gotten the advice that my grants weren't well written. I don't think I've ever received that. Maybe at the beginning, my aims weren't clear, or maybe they were interdependent and there were some lessons that I had to learn. But usually it's, I'm committed. I have 1 grant, on this topic. Maybe it's my school-based mental health. It has its own kind of mold that I follow. The same literature I might have to update, but I really recycle it a lot. And so because only 5 to 10% of grants are funded, so you just, create this plan, submit the same proposal to multiple funding sources. In case it comes up in your mind, well, what if they all get accepted? Well, you take the highest rank one. But the other thing that you can do is you can, this is just like more of a strategy, is you can just slightly change the aims as well. So you wouldn't necessarily have to get both awards back. And, really it's when you're first starting out your career, which it seems like we have a lot of fellows all today, it's really thinking on a 5-year plan. So developing a strategic plan. So in year 1, you need to document, and usually this is with startup money, or just with some experience that you have preliminary data, and I'm going to explain that in a minute. And then you apply, because you need your preliminary data for the pilot funding that you'll then apply for in your second or third year. And then year 4 or 5 in that faculty position is really when you start going for the big ones, like the $500,000 grants, like an RO1 or such. So this is just, again, high level, just trying to explain the process for you, or the system, because there's a formula or like some instructions to playing this game that I've learned and others have taught me. So again, in year 1, you really need to, when you're applying for your pilot grants, you really need to show that there are some basic foundational skills that you have as an investigator, because really you're going to sell people on not only your research idea, but when we're junior faculty, we have to sell people on us as well, or our reviewers on us. And so when I use the word preliminary, that these are the types of things that you want to document. You know, can you recruit? If you're going into an intervention, can you deliver an intervention? You know, in this grant of mine, I said I wanted to do metabolomics. Well, I've never done metabolomics, but then at least I have a co-investigator that they have done metabolomics, right? And then, did I ever have any data on this topic, which this grant was about sleep extension on metabolism and metabolomics specifically. And so I needed to share with them that maybe I don't have that experience, but my team has that experience. So this is that preliminary data that you can't move on to that stage 2, which is that pilot grant, until you have this data. So then in years 2 and 3, I would say it takes about a year to document that you have some, or form your year 1 of your assistant professorship. You know, you just got there. Now you have to get some colleagues, get some group of people together, right, to write these. And that's where that preliminary data will come from. That takes about a year. And then in years 2 and 3, you can start submitting some pilot studies. Now, pilot studies are where you do the exact big study, but very small scale. And so usually for an intervention work, it's going to be called a feasibility study, right? Because now you get a little bit of money, and pilot studies are usually funded internally, or maybe your associations will have them. This is not really NIH funds these, or your big foundations fund these. It's really your university probably has $20,000, $30,000 grants that you can apply for to collect pilot money, or maybe you were given a startup package to collect some pilot money, because you really, as the investigator, you really have to start building your CV and your bio sketch on your ability to become a PI, right? You're always convincing people that you will be the best PI. And so you have to collect under your belt, which means you will have documentation that you've been able to get small awards, you've completed them, you've been able to write manuscripts that document the findings that you've had. Before anyone's going to give you 500,000, they just want to see that you've done something pretty darn good with 30,000. So again, this is the pilot. And then the game plan year 4 and 5 is when you write that big grant that you are powered to do. It's the big one. It's the one where you need $500,000, right? That's the big game plan. So I'm going to stop with the system now and kind of move forward to some things about you have your vision now of what you need to do, but where do you get your funding? So let's move to that topic. So I do see 3 questions in the chat. Should I stop? Do we have some questions? Keep going? Okay. Ask your colleagues for funded grants. Everyone, you know, it's nice to start with a mold. Don't start from scratch. Even completing a template of someone else's grant and taking the information is still going to take you a lot of time to mold. You know, so once you kind of learn the lay of the land of where you're going from your colleagues and the new people that you're partnering with, you know, where have you been successful applying for grants? Where have you been? Then you want to collect these funded grants. For example, American Heart Association, they have a scientist development grant. And at my location, I couldn't find one of those, but I had a lot of people that were applying to NIH, specifically NIDDK, which is the Diabetes Association, and they had KO1s. So I took the KO1, right? At least it's something. You need to start with something. You know, how did they pitch your local environment? How did they pitch their career plan? How many mentors did they have, right? So when you're at that level, and I'm sure the people that have just submitted the KO1s, hopefully you didn't start from scratch and you were able to pull in and find some senior people that can help you with some really solid grants. I often tell people to ask your, senior mentors or senior colleagues, like, what was your favorite grant? Can you send me your favorite grant, the one that you're most proud of? And I think that is also a really good idea, because why you want these is you want to see how the previous grantee, how did they pitch your grant? How was it how was their grant formatted? And everyone has their own pet peeves to what they like or dislike, and formatting is such a big deal. So it's really nice to see from colleagues what they've done. When you have that, you review the funded grant, and then you need to find a strategy. So how did this grant that you're holding on to, this example, how did it align with the funder's mission? And then think about your grant and how, if theirs was funded and this is how they aligned it, of how it met NIDDK or NCI or American Heart, how does yours line up with their vision? How many aims did they have? Sometimes people just have 3 aims because they think that that's the best. Well, I'll tell you, for an American Heart Association, for a career development scientist, they like 2. They like you, it's a 3-year grant, and they just want you to accomplish 2 things. 3 is too much for them, right? So these are the things that you would learn. Are the aims mechanistic? So is it really, going to NIDDK as a behavioral researcher, they don't really like me because not me personally, but they don't really like I don't know, they could not like me personally, but my grants are not mechanistic enough for them. Now, they loved my metabolomics grant, but if I want to change sleep and that's my outcome, they're not really keen on that, right? Who likes more RCTs versus they don't want you to do a randomized control trial? In these grants that you're looking, is there preliminary data? Do you have that same level of preliminary data that they used in their grant? Because if not, maybe it's not your time now, and keep collecting that preliminary data. Formats, how is it formatted? Are there sections that might surprise you of things that they want, but you haven't prepared and you need more data for that section? One question I was asked recently, and I'm seeing more and more, is how for diversity, inclusion, how do my methods ensure that I'm going to get the representative sample? So I had to speak specifically of how I was going to have that more equitable lens on my grant. And I think we're going to start seeing this more and more because it's super important. And I think, NIH is just tired of spending money on programs that only work in our white urban communities, middle-class communities. And they really want to see us working with not those more target populations that might be closer by a university. They want us to go out and actually help communities that are diverse and more vulnerable and high need. So these are all really important things that you need to find and do your homework. So when you're learning about your funder, this is one funder that I'm learning about right now because I want to submit a grant. They have a grant opportunity due. And this is they're called WT Grant Foundation. I found this mechanism called this title. It said that they welcome studies that pursue these 3 aims. You have to have at least one of these 3 that you're targeting for your grant application. And then it says it's due August 3rd. So that's great. So now I'm only giving myself about a month to submit this, but I have a grant application that I've submitted previously to the WT Grant Foundation for a different grant. And so I'm going to take it and I think I can just mold it to maybe fit these aims. So I think I could do it in about 3 weeks, maybe not, but if I miss this, I only have one chance because it's only once a year. So these are things that you want to pay attention to. NIH has their 3 cycles. When I was at American Heart, they had 2 cycles for career awards. So again, it's that 5-year plan, really planning on submitting the same grant proposal probably 2 or 3 times with revisions and such. All right, I'm going to pause. Any immediate questions? Okay, let's talk about the aims page. The aims page is the most critical part of the application. And I think this is in my tips and tricks later, but sometimes for your second and third reviewer, typically journals, or well, journals too, but typically grant reviews are done by one primary reviewer and then a second and a third reviewer. And the primary reviewer is typically the one that will review the whole package, but second and third reviewers, they might only read your aims page. So the aims page is a formula. Here is one way to think about that formula. You need to provide a short summary, identify the gaps, what is your overall hypothesis, then list your aims, then the goals of each aim, why is this important, and then you want to, if you can, include some type of graphic. The jury's out. 50% of people out of 100 are going to submit a graphic. 50% of people are going to tell you never submit a graphic. It is all individual preference. My example I'm going to show you does have a graphic, but I feel like if you can, you're so limited in one page, and if a graphic or some data that you have, preliminary data, a picture is 1,000 words. I don't know if they still use that phrase, but I think that if used correctly, it does help that reviewer. So when you receive your colleagues' grants and you have that aim page, look for that hidden formula. And I'm going to give you a couple more bits and pieces of information for the aims page. But when you have that grant, and you have that aims page in front of you, you can see my example here. What you want to go through and say, okay, here's how they provided that short summary. Here's their gap in knowledge. Here's their hypothesis. Kind of highlight or note each of those to see how they worded it so that you can follow suit. So there is a hidden formula. So in that opening sentence, you need to capture that reviewer right from the beginning. You need to consider what's the mission of the funder, and you need to make sure that those keywords highlight that mission right away. So in my that example that I gave you a few slides ago, obesity affects 1/3 of US adolescents, right? That's what they wanted to see right then. Like, this is not a problem. This is not a small group. It's not a population that is very small that my work can improve. It is a population that is hundreds of thousands of people that my research could move forward their lives. What's the current knowledge? And that's, you might have 2 to 4 sentences that you have time to include, and you're trying to set the reviewer up perfectly so that you then can just bold or italics or underline whatever you like to use for that gap in knowledge. So for me, I include, we know that type 2 diabetes is associated with insulin resistance, and we know that that's related to mortality. We know that half of our youth have type 2 diabetes, and we know that the RCTs have failed. We know that these kids get type 2 diabetes 4 times faster, similar to other adults, right? Like, I'm really setting them up. This is a critical window. And then I say, here is my gap. No lifestyle interventions to date have done this, right? That's the gap. I'm the first one to do it. Then they want to see, well, where are you going next? Well, to design more effective obesity intervention in adolescents, I first need to understand this mechanism, right? And then I propose my aims for this feasibility step or study, which is the critical first step before I move on to my pilot study. So you can see in part 1, I identified that gap. In part 2, I am in these highlighted sections telling them about the preliminary data of what we know in this field. And then I have a part 3 that is in the wrong place. Hold on, I'm going to go and then I'm going to go back. And then part 3 is my rationale, aims, and hypotheses. So this is a feasibility study. What you're not seeing here are hypotheses after each of these aims, and that's because it's this very specific study, a pilot RCT feasibility study. So you don't have to have aims for those ones. Everything else you probably have to, or you don't have to have hypotheses for, but everything else you have to have hypotheses for. But note, this is, no studies have done it. Here's my main goal, and bam, here are my aims. I think I've already said this, but I'm just gonna say it again. Preliminary data and pilot data, don't use them interchangeably. It's like one of those junior mistakes. Don't make it. They're two different things. Like I said before, preliminary data, feasibility of I can recruit, I can do measurement, I can consent kids. Pilot data, here I've done it, in 5 kids, and I have shown the same, every kid was able to improve their sleep by 2 hours. See it, now I need to go and do it in 20 kids. Okay. I'm going to tell you one more thing and then I'll pause for questions. When you're writing that aims page, and you are writing this as a KO1 award or a pilot award, more of a junior faculty, you need to make sure that your bio sketch that you submit and that personal statement is your opportunity to tell them and completely align it with those aims so that you can say, because this is going to be one of your baby studies, this is your pilot, this is you proving to the bigger world that you can get $20,000 for research. So you need to prove to that person, usually it's internally, that I can do this. I have 15 years of experience in human subjects. Well, that started like an undergrad where I counted that, right? And so I needed them to know very early in my career that this isn't the first time I've done research. I've actually done some research, but this is maybe the first time I'm PI. Okay, so you want to make sure those two align. Any questions? I see no new chat. Is this a good pace? Thumbs up. You guys are quiet. Okay. Study design. I'm going to keep going. How to choose a study design. I only have a couple slides on this, but I just feel like it's such a key component of the writing process. And what I wanted to include for you, especially the newer folks, is just a kind of a few schemes of how studies kind of build up on each other. So this one will kind of tell you the difference. There's observational, there's experimental, there's cohort studies, then there's your case control, and they tell you a few little key notes about each of those. There's your retrospective and prospective study as well. So this is just trying to give you some tips and tricks about why you might want to use these study designs and some language beneath that you might be able to use in your protocol to justify why you're using that language. On a spectrum, your case reports and your cross-sectional studies, those are going to be at the bottom of those are going to be your weakest and maybe serve as preliminary data. And then as you get up, it's that randomized control trial, or even the systematic review of a whole bunch of randomized controlled trials that's going to give you the strongest evidence for science. So keep that in mind when you are writing your background, really pitching where your gap is. Think of it also in line of the existing evidence. And then the last study design cheat sheet here that I love to give my students and junior faculty is, how to go through your clinical research. So, is there an experiment? Is it just observation? Is it randomized? Is it not? And it kind of goes through, what is that exposure? What's your outcome? So exposure, I'm an epidemiologist by training, so I love these words. So exposure, if they were exposed to poor sleep, would their outcome, obesity, be different? So
Dr. Kaar?
Yes.
We do have a question in the chat. Are there specific study designs suited for certain grants?
Oh, I'm going to say yes, because I can use this slide. Can you see my pointer? Okay, so I'm going to say yes, and I'm going to say it might not be at the funder level, but it might be at the amount of money that you get and the time that you get. So for a randomized control trial, to get a randomized controlled trial to be, and we haven't talked about this, but we will, to be powered appropriately, you might need, I don't know, 100 kids. I'm just going to focus on my research here, kids or just humans, and you might need 50-50. And so you might not have, if you need to do MRIs and metabolomics and bring them in for 3 or 4 visits, and your grant that you're applying for is only $20,000, you can't do a full randomized control trial. That's really your big $500,000 trial. So I think you're going to be more limited with what study designs you can use, depending on how much money your funder has. And so in that case, it might be just a pilot study, and you can do, I'm going to do 20, or it could, because I have money to do 20, or maybe they're giving you 5,000 and you can hire a student and you can do maybe an observational study, but a retrospective chart review and pull data and try to, get some preliminary data with $5,000. Does that answer your question, or do you want me to follow up anymore? And the other question? Oh, here, you submitted
one more comment.
Grantsmanship process is a game. If you submitted a K, which really supports your salary, would you suggest submitting the same or similar grant aim to a different foundation in that same year? Okay, good. Priscilla, I'm glad I answered your question. Okay, so Dee Dee, great question. I love these questions. So you submitted a K, you're right. It does, K awards, they really pay 75% of your salary, and that is to protect your university, your salary from your clinical work or from other research that you're dedicated to accomplishing those new learning aims in your K. Now, if you are awarded the K, you cannot submit those aims to another anyone else, but your K is like your gold standard, so you accept that. However, like, let me give you an example. I submitted my American Heart Association Career Development Award, the same aims and the same plan to American Heart Association, and it was the same as my KO1 application. Then at the end, I did not get my KO1 or a fundable score, but AHA, I did get a fundable score. I could have just accepted, this is what I did. I just accepted the AHA career award. And I was like, I'm done with career awards. It took me 3 years to get this. I'm not writing another one. However, hindsight is 2020. If I had the opportunity to go back 7 years ago, I would have made the changes to my KO1 application and continued to submit it until I received that KO1, because getting a KO1 makes you a part of the NIH club, and it is really, really hard to get there if you have any other career funding, because you're not in their club. And really what I'm seeing now later in my career is that my colleagues that went from that KO1, they got the RO3, R21, then they went straight to their RO1. They are more successful in this horrible funding environment than I am to get in the game at the RO1 level. I have submitted 7, I think I'm up to 9 RO1s. 0 have ever been discussed. That is a whole heck of a lot of work, and they don't even give me feedback, right? They don't discuss it. And so if I feel like if I could do it all over again, you can submit all you want to these smaller foundations, but your goal should be a KO1. Okay. All right, those were amazing questions. Okay, and keep writing them down. If we're moving on to a different topic, keep writing them down and we can address things that are off of these topics at the end too. Okay, so the last thing, I just want to talk about a few remaining things when you're writing these grant proposals. The project narrative is something we have not talked about. The project narrative, I think there's only 3 slides here, but big picture, you need to address the W. So who is your audience? Make sure that you understand where that, we did the homework previously on who is our funder, what do they like. We have examples from our colleagues and friends about how they pitch their work to that grant funder. So, use that. Who's your audience? Now, what are you addressing? What's the importance of your question? What tools are you going to use? Are you just going to be using retrospective data because you only have $5,000? Or are you going to be doing an RCT with like high-end assessments, MRIs and such, because you have 500,000? What are your deliverables? So in my grant that I keep using, in my metabolomics grant, my deliverable was actually that I could improve sleep for 90 minutes in adolescence. My deliverable and that I could collect metabolomics. I did not in my pilot grant say what I thought the pathway was going to be, and that I would see a significant difference between my control and my, because I didn't have enough money, right? So I scaled it back, and my deliverable was, in these 20 kids, I'm going to show you that I can improve sleep. Where will the research lead? As you saw in that example that I keep using throughout, is my future direction was that NIH R34. This internal CU, University of Colorado funding, you are paying for me to get my pilot data so that I can then go to NIH and get this R34, which is a $500,000 study. Instead of an R01, it's an R34, and it's a clinical trial. And then why do we address this now? Why is the timing now? Why are you the person to submit this research? A real quick note on that. I submitted to National Institute of Mental Health. This is my grant, or my proposal R01, my last 2 proposals to NIMH. I am not a psychologist or a social worker or a psychiatrist. I have them all on my team. That wasn't good enough. NIMH said, they didn't review it. They said, you have a great research question. It's like youth and mental health. The time is now. Like I didn't have to convince them. The time is now. You aren't the person to write you aren't the best PI. Whoa. I did have to put that aside for like 10 days. And I did have to do a lot of self-care because that hurt me, right? So you really have to think, if I could do that one again, and I will, but the next time I go in, I'm going to go as co-PI with someone that has PI funding at NIMH, and go in as multiple PI because she is a psychologist and she has R01 funding from them. They don't know anything about me and IMH, and so they just no thanks. Great research question. No to you. So these are the things that you're going to learn, lessons you learn, and that's why you want to go to as many of these research talks as possible, because what you want is that person talking to you like I am today to tell you all of the secrets and lessons learned, so you do not have to learn them. All right, big picture on your narrative. You have your specific aims. In your narrative, you have the 3 blue boxes below. You have your significance, your innovation, and your approach. So why this project? What is the value with supporting this data? What's new and different compared to past? And yep. And how are you going to, how are these hypotheses will be tested with other validated approaches? Go for it.
Yeah, there's a question in the chat. Can you talk about the realities of self-care when you get rejected? What do you do?
Dee Dee, that's great. I want to keep this like, I'm over 21, so I like to have a cocktail. I think so. That is one thing I like to do. I like to go away and like take a day, if I can, and just sulk and be miserable, because I need to grieve, because that was like, I mean, I have 2 real children, but all of my grant proposals are my babies too, right? You worked 6 months on that if it was the first time you submitted. Now this is like for my heart and soul goes into that first, R01, and I created that baby from scratch, and I gave it to someone and they're like, great idea, you suck as a PI. Whoa! Like I had to remove myself. I sent it to my co-investigators and I was like, you guys read it. I'll talk to you in 2 weeks. Don't talk to me about it. And I had to separate myself from that work for 2 weeks. I could not write manuscripts for 2 weeks. I did not want to write a grant. I was done with that it took all of my creative energy. So what I've learned over, my, I think I've submitted, like I said, 40 to 50, and most of them have been rejected. I just know that I need about 2 weeks. And I just need to do my actionable items that are not creative and aren't from like the love that I pour into my research and my grants. And I need to focus also on getting back in there with the patients or getting back in there with the schools. But I need 2 weeks. Just give me 2 weeks and I read, I watch Netflix, I watch whatever. I just need to decompress. Dee Dee, I hope that helped. It's hard. I really, really didn't like the people that told me that I was a bad PI. That was very, very hurtful. I'm still like, that was a couple years ago and it still like really hurts me. But you guys will never be told that because I'm giving you all of those lessons learned. Okay, these are great. Keep them coming. Okay, so one thing when you are doing your narrative and you have all of these great examples, you need to go back to the actual funders page on what are your requirements for that application, because everyone is different. So I submitted 3 different grants recently, or grant proposals. A proposal is what you submit, a grant is what is funded. Just FYI, those 2 terms are also used interchangeably, but they actually mean different things. So I submitted some recent proposals, and one in this box here, this is really like NIH, what they like. So they want that research strategy, they call it, not a research narrative or a project narrative. They want you, to call it this. They want you to have these sections, and they want you to have approach, and then you want these sections. But then if you submit 6 months from now, they might change it because they love changing the BioSketch format, the format of how we do things. They add new, sections like scientific premises recently added. So you really need to follow where are they now at this cycle, because it just makes reviewers mad at you, and you don't want that. And then another one I just submitted, they wanted me to start off with a summary of proposed work, and I was only allowed 100 words. And then they wanted me to have another section on project significance and potential impact, and keep going down here. Anticipated products, I didn't even know, well, mine wasn't producing something, a product, so I had to kind of dig deep to see what is the product that I can say. And then another one was just really simple. They're like, give me the significance, what's your research plan, tell me your personnel, who do you want, and what are your resources, right? So you really want to pay attention to these details. So tips and trick, assume your reviewers know nothing about you or your work. It's just best, they have nothing to do with you. They don't know anything. Use the text from the funding announcement that highlights how your work will address one of their needs and focus areas. So use their key terminology. An example, if I'm going to, for my school-based mental health work, if I'm going to NIMH, they want to see suicide prevention. They want me to use those words. They want me, I don't have to measure suicide as an outcome, but their focus is on decreasing suicide in youth, right? Another grant funding, they don't want suicide. They want social emotional learning. My program is social emotional learning. It can reduce suicide, but I'm not pitching it to them that way. I'm pitching it social emotional learning because that's their focus. The third way I can pitch the same grant, just tweaking it, is to health literacy. This is all the same. I'm doing the same darn grant in all 3 of these, but the third way I can pitch it as a mental health literacy, grant focus. So again, I'm using the funding announcement where I'm trying to go, and I'm just using their words to pitch it in a unique way. Consider framing your work using a theory or a mechanism. And that is what people sometimes want to see on that specific aims page, is that you have a vision and your aim, you are solving what? Is it a mechanism? You know, this metabolite leads to this change that leads to this, which is maybe more common in cancer research and my behavioral research. You know, is it a theory of change? Am I changing patients, providers? Who am I changing their behavior? So common problems that come about with the research narrative: the project you plan to do is not clearly defined. You know, so they get through the aims and they're like, is this a RCT? Is this, they're going to observe them people? Like, what are they doing? You don't want anyone ever to not know what they're doing out. Like, you want them to know what they're doing in the aims page. The other problem with the narrative, the significance of the project doesn't actually match what you're saying that you're going to do. That's a huge no-no. And the lack of information regarding the setting, population, and outcomes. Okay, you said you're going to do this and you just said youth. Where are you getting them from? Who are these youth? Are they vulnerable population, community? Is it, you know, clinic? Is it school-based? They really want to know, who's that population? Are they generalizable to other populations? Because that's what they're looking for in that population section is, are these all white, urban, middle class youth? Okay, well that's probably not good enough. It's not good enough, right? And so you need a population that serves the demographic that you want to serve, that serves the demographic of X disease. You want to, I think this is the last slide, like you are, no, a couple more slides and then I can pause again for questions. You want to list potential problems and their solutions. You do not want your reviewer to point out the problems of your grant. You want to take the opportunity to point out all of the problems and then tell them what you're going to do. So in one of my last grants, one of my roadblocks was, and they all call this section differently. This is what this grant mechanism or this funder wanted me to call these things. But just, you know, when anyone asks you like problems and alternative solutions. So challenges within the school intervention, like delivering in schools is tricky. If people don't do it and you don't have a really good relationship with your schools, you can't do it very easily. So they want to see that. They want to see, well, how are you going to make sure you maintain them and you don't lose all of your sample? So these are different things that I wanted to point out to them. I know these are like the 3 to 4 top barriers of completing my, if I get this awarded, and I want you to know, I know what they are and I have a plan. Power analysis. You don't always need a power analysis, but you should put a power analysis in whenever possible, because people want to know the data that you collect with this $20,000 or $10,000 or $500,000. Do you have enough that if you get a p-value that you can deem it that you are powered to say this? So you have to work with a biostatistician, and I'll review that too, but you want to really think about the power that you need to do what you want to do. Lastly, you need to pay attention to detail. You need to have someone go through with a fine-tooth comb, no mistakes, no spelling mistakes, no punctuation mistakes, all of that. You want it perfect, perfect. It is the best work you've ever done. Perfect. Okay. We have time to take a 5-minute break. We can answer questions. Let's see if there's any more questions in the chat. So it is 12, I'm going to say 55. Okay, we have a 3-minute break because it takes me a little bit of time to get through the last one. I'm a little over time. Can we take like a 3-minute stretch break and come right back? Does that sound good to everyone? Let's start again at whatever, it's 1 o'clock Mountain Time. So wherever you are, 3 minutes, let's just get up and I will see you in 3 minutes and we'll continue. All right, everyone. Quickly in the chat, can you tell me, well, we just wait till everyone comes back, can you tell me if you've ever submitted a protocol? So you had your grant and then you had to submit a protocol. Let's hear where we are with that. Have you submitted a protocol that you were PI on? Okay. Well, then I'm glad I'm talking about it. And I know that this isn't necessarily what you might expect from a grant writing course, but I think that it's missing. And I want to give you just some quick tips, because I think that you can I want you to, there are two different things is my main point here, is that when you get that grant, the grant is not the protocol. The protocol is a little different. And depending on if you're doing animal studies or human subject studies, you will have to go to an ethics board and do an institutional review board to do your research, and you'll have to develop a protocol. And so I just want to, when I'm writing a grant, these things I'm keeping these things in mind, because these are the building blocks for you to do what you're saying that you are doing in your grant, and that the reviewer is thinking about when they're reviewing yours. So you want to have some of these things, you want to keep these in mind. Okay, thanks Jennifer, thanks Jade for sharing those. So let's just review some of these things. Okay, so a protocol. So you still have your hypotheses and your specific aims, which you do in your grant, and you can cut and paste those, and you can cut and paste your background and significance, as well as your preliminary studies. But then they want more detail to the research methods, right? So what are those outcome measures? Who is your population? They're again looking at generalizability. They're looking at feasibility. They're looking at a bit like, can you recruit them? So if you're coming from clinic and I want to recruit kids with not type 2 diabetes, I want them to have pre-diabetes. Well, to define pre-diabetes, it's like a point, I don't know, 3 to 5 percentage points on one parameter in HbA1c, and I need them to be in that needle in a haystack. Well, how many of those people do you actually see? Is that feasible, right? And so even though that might not be in your grant, after you kind of think about it later on for the purposes of your IRB, you can kind of think, well, maybe actually a reviewer could ding me for that, because maybe they don't know that I actually have enough sample or participants to recruit from, right? So these are what I want you to kind of think about when you're going back and forth. So there's just a list here, and then I'm just not reviewing all of these. I'm just going to kind of, you have your aims and hypotheses, you have your background significance, you copied and pasted that from your grant. I put in my feasibility that I can do this. So their outcome measures are going to look a little bit maybe different than how you pitch your outcome measures in your grant. It depends, but they might look different. And so, I had to list them separately like I did here. This I didn't include in my grant. I might have just put the participant section up at the top, but I didn't include in a lot of detail inclusion, exclusion, because that doesn't go in a grant. Now you want to be thinking about it at your level of the grant, maybe not to this level, but you might want to think of kind of how I had explained my pre-diabetes is defined as this, because I really want to then show in my proposal that I have at Children's Hospital Colorado, I have access to 30 of these patients a year, and if I get 15 of them, I'll have enough to do my research, something like that. But that would
yeah, I can do that.
That would be in your feasibility preliminary studies section in your grant or proposal, in your proposal. Here, you're going to go into more details, which you don't in your grant proposal, but you're going to go in more details about consent. But what you need to know for your proposal is that, because for your budget, you need to already know that I want to pay each one of my participants $150 for participating in the study. And you need to know this information at the time that you're submitting, because you want to put that in there, right? So you see they kind of align, and no one really talks about the second process. And I just want you to be thinking about it. It's not a game changer if you don't do it. I just want you to be thinking about it. So again, you know, a little bit different here. They want the study procedures, they want your design, our IRB, but I think a grant, you know, might really like this as well as a table. Like, this is exactly when I'm going to do each one of these things, right? The reason why you need this is for the IRB is so they can see, well, how many visits are they coming in and what are you asking them? But on the other end, for a grant proposal, this is really nice for your budget, right? Because each one of these comes with a cost. So this is something, again, nice to kind of do these things at the same time or in parallel. Assessments. So for my my proposal, I might have said, I'm just going to change sleep duration. And I probably put a few things. I'm going to use an accelerometer. I'm going to use some fancy objective measures. I probably didn't go into detail because space was an issue. So over here with the IRB, they want to know, well, what are you using? Is it validated? You know, can it harm the participant, right? Because they want to know risks of procedures. So if you're doing blood, like, well, what's their risk? What, like, and what justifies you doing that for the risk that it's here? They want to even see risk for questionnaires and privacy, right? Because you can lose their data.
Dr. Kaar?
Yep.
We have a question in the
Love it.
chat.
Okay.
I'm learning about how positions are funded in the academic medical environment, how a mix of clinical and research time are funded from different budget bins. The one primary question I'm working on is, what do I want my clinical research ratio to look like, which will determine what my position will look like. I'm hoping you can share how you resolve this issue for yourself and how you arrive to your current position addressing this issue.
Okay, I love that. And right above that, I just noticed Dee Dee, she submitted 3 and one was reliant on the IRB. Yes. Let me just take a note of that. And then for the question about the position, I'm going to come back to your question as soon as I will. I'm going to answer it. Just let me finish this part. And then I love, like, that's an awesome question. Okay. So what Dee Dee is saying is that, and this is what happens and why you want to do them in parallel, is because NIH, like for your K01, or they're going to give you a notice of award. So we want you, we are going to give you the money. This is your notice. You need to have your IRB approved. Depending on your institutions, it could take 3 to 6 months to get your IRB approved. And they want you to start now. So again, that's probably what Dee Dee is referring to, that she couldn't actually get her grant until she submitted her protocol. One thing I do that helps that position is in my grant proposal, I will say, like, when I submit my proposal, I already have an IRB number in there from my institution, and I'll put pending approval. And then I'll put, for a clinical trial, I also put my clinical trial number in there. If you're doing an RCT, and I might say, you know, clinical trial number this, or clinical trial application submitted on this date, then they know, like, you're serious and you're already moving these things along, because that is a huge time, those 2 items are a huge time commitment. Okay, we're almost to that other question. I have a few more slides here. So then again, for the IRB, they don't need a lot of information. I mean, you could copy and paste but they just want some simple information on how are you going to address your aims? What is your data analysis plan? Then they want summarized knowledge to be gained. So what are you learning through this, which is different. Technically, a grant doesn't ask you that, although you can get bits and pieces from other parts of your grant. Okay. So I'm just gonna, for this person, can you tell me your name? And are you an MD, assistant professor? Can you can I see you? This is such a great question.
Yes, I'm actually a postdoc fellow.
Okay, and what is your discipline?
I am in clinical my department, clinical cancer genetics. And
Okay.
so we're learning, I'm learning how to promote genetic testing
Okay.
among English, Spanish, and Mandarin speakers.
Okay.
And I come from a clinical background, palliative care.
Mhm.
And so I did some studies using gene expression as biomarkers. So I have so my background is, this is what makes it more difficult for me, is that I actually come from a palliative care chaplain background and also mind body medicine. So I'm learning how I'm kind of square peg, trying to fit in. And yet I have a lot of background skills and learning how to, find my place. So my mentor has been really good and really awesome and given me some really good advice how to proceed. And so we were trying to pitch kind of a assistant clinical professor position for me.
Yeah.
But meeting the HR, resistance, because how do I fit into that position, which is actually made former like psychologist. So I kind of resonated with your story earlier. So
okay.
Okay.
No, this is awesome. Thank you I just needed a little bit more background, and thank you. So just like to kind of bring in and answer your question more generally, and through that I'll give some more specifics. When you are coming in from a postdoctoral like PhD world or a fellowship MD world kind of postdoc, your next transition is typically like an assistant professor role or perhaps an instructor role at a university if you want to be in academic medicine and do research within academic medicine. Typically what happens is if you have a clinical fellowship, if you're an MD, and this is for the MDs, and you have a clinical fellowship or PhD psychologist, and you've only done clinical fellowships, and you have not done a 1 to 2 year to 3 year research fellowship, sometimes what happens is a university might hire you on as an instructor. They want you to get that research experience. And then typically what I see in a lot of our major universities is they put you forward on this path of a K01 application or a K23 application, depending on an MD or a PhD. And what you need to do is have them set aside as much time as possible for you to focus on your research. So I wear a hat in the Department of Surgery. So for our new surgery faculty that come in and they want to pursue research, they need to, then we protect 50% of their time for 3 years so they can get their startup. And so you'll see some of those things, but I think it's, some people only do 25%. That you get what you can get, but you want to shoot for 50% to 75%. And then when you get your R or you get your KO1, that covers 75%. You're maxed out. So my surgeons have issues with that, but the rest of us that are not surgeons don't have issues with that high bar that they set. But these are things that you want to be thinking about. And that's where his question was coming from. So excellent question. Thank you so much. Okay. Let's continue on just a few more slides. So data collection, I don't know, I can't, wait, I like seeing all of you and sometimes you guys disappear. Okay. So you guys can still see me, right? Or no, I'm not sharing my screen. Did I stop? That's why. Okay, here we go. All right, I knew something was off, but I couldn't find you. Okay, here we go. Data collection. Excel data or Access, I used that 20 years ago. Excel, some people use now. Really, a lot of your bigger grant funders, they want it to be secure, HIPAA compliant, I don't know, FERPA compliant. If it's in schools, they want it to be legit. I have to use REDCap. My university, has a license for REDCap. So, find out where can you collect data, because when you start playing with the bigger foundations and NIH, they want it, in a safe environment. You're going to have to learn how to build a data dictionary. You're going to collect data, and you want to make sure that the data that you collect not only addresses that you'll get the answers to your aims, or you're collecting all of that data, but in a format that works for not only you, but for your biostatistician. So I just am including a few slides for you on that. So you need a biostatistician. I'm an epidemiologist. I still have a biostatistician. We talk very different languages. I feel like an epidemiologist can speak biostats, but more people that aren't one of those can speak with an epidemiologist versus a biostatistician. For those biostatisticians out there, I'm sorry that I said that, but I think you probably understand. You need one. You involve them early at the time you're writing your grant. You put money in your grant so that you can use them, work with them. You learn their language. And so I just put some resources here that you can go and look at. But you really want them on board at the time of writing your aims page. Last thing, you now have a whole bunch of data. You are analyzing it. You want to get the most out of your data as possible, because if it's that preliminary data, you got $5,000 or you did it for free, and you need publications out of that, because then you need to go to your plan 2, which is, or step 2, which is that to get that pilot award, right? And then you need to publish all of that very strategically and timely to get you enough data so you can then submit that big grant, the R01. So what you want to do is, you could do it by aim, but sometimes you find something so different than your aim and you have to kind of pitch it differently, because maybe when you started your grant like 8 years ago when it was funded and you're finally ready to fund it, no one really cares about that question anymore. We're getting that with COVID now. We're trying to get a paper funded, and we're doing smell tests with kids and COVID. No one wants it. We have to like repitch it because it's 2 years later. No one cares. And so you have to, list out your main findings, how to best communicate, and to who can you communicate those findings? Who cares now, 8 years later or 3 years later, and then create a plan. And I'm saying that because you want to submit an app. You want to get the biggest bang for your buck, I think is that phrase. You want to submit an abstract, because then you can put that on your CV. You want to see that CV, don't have just 50 abstracts and 3 publications. You want to see the majority of those abstracts going and moving into those manuscripts. And then you can draft your manuscript, submit your abstract, draft that manuscript while you're waiting. It's 3 to 4 months, and now your conference is coming closer. You find out if you have a talk or not, and you can then go and submit your manuscript, because getting a manuscript like out there, you'll have to read all the conference details, but typically, getting a paper published takes 6-9 months, a year. And so you have time, so just go ahead and submit away. The other resources I wanted to share with you is I love Jane. So you can type in like your abstract or your title, and it'll tell you journals that you can go to. Then you want to find about 5, I always tell people, find 5 journals that you like. Go and find the impact factor and rank them. The highest impact factor, your Nature's, your Lancet, your BMJ, all of those. Then you rank them and you submit to the highest first. List 5, and you send out your paper to review to all of your authors. Then you say, here's the list of 5 that I'm going to send in this order, and you just have them approve it then, like just so they're all on the same page. Because for those top ones, with those BMJ and Lancet and JAMA, they turn it, but like they'll like turn it back to you and most likely reject you within like 24 hours. So you don't want to have to then go back out to everyone and ask for new permissions. You just want to format. Okay, to end, I pulled some advice from some colleagues today, that what was the best advice you were ever given if you could start over again. And these are the 3 slides that I wanted to end with. So aims page, critical component. One of them, and this is a very senior person, she said that you spend 80% of your time on the grant, like so 100% of the grant writing time on that proposal, 80% is spent on the aims. That's substantial. Like just keep that in mind when you're writing, that is where you put it, your time. You share those aims with as many people in and outside of your field as possible. And you know that, and we talked about this, it's going to be the 2nd and 3rd reviewers, probably only thing that they read, they'll skim the rest, and their score that they give you is based on your aims page alone. I thought this was great advice. A few more things, etiquette. So your KO1s, your even if you're writing a pilot award or, you know, in RO1, sometimes they're going to ask for letters of, like for me, they'll ask, well, are your schools on board? Do you have schools on board? So you draft a lot of letters of support. So draft those letters of support. You can write them verbatim. You can write them like fully out, give them to your person in plenty of time. I always give them a due date of 7 to 10 days before my actual due date to my Office of Grants and Contracts, because they're going to be late and you don't want their being late to impact your your proposal writing. And also, if they don't get it in time, you have time to quickly reframe and get a letter of support from someone else, especially for me in schools. Sometimes they back out when you actually make them sign something. You want to give yourself some time. 4 to 6 months is usually like that start to finish. Like, I have an idea, I want to do this. And then 4 to 6 months later, you can have a proposal all together. It's not something you do in your free time. And that goes back to that question we had. This isn't something I have 100% clinical role. I'm going to do this in the nights and weekends. It's impossible. It's too, you're going to burn out. I also like to share with people writing, you know, you need your best time, your most creative time. You know, it's not right after you got a grant rejection. You know, block off your schedule. And then I thought this was really good. So from some of the people I asked are reviewers at NIH, and they gave us these tips and tricks. Reviewers are asked to review many grants in a short amount of time. Most reviewers will skim read. So make your points clear and simple. Use tables, bullets, and to summarize your key elements. Read the reviewer criteria. Make sure you're addressing each of those criteria very clearly. So in other words, hand them what they need and don't make them have to work to find it. I loved that. Bold and underline the specific language so reviewers can see it immediately. Some people do italics. I will say I'm doing some health literacy, mental health literacy work right now, and we are learning that italics is not the best because it's very hard for people to read. And so bold and underline, that's why I'm not putting italics here. And then don't assume the reviewers know anything about you or your field. And the only information they have is what is written in those documents that you provide. So in summary, be patient, stay focused, and collaborate. This is the best part of academics is you collaborate and get to meet like-minded people. So you have to have fun. What do we think? I ended on time and 2 minutes early, or no, I'm about 2 minutes late. So I'm glad we only took 3 minutes. What else? What else can I help you with? Is there any topic I didn't address that you have a question? Thank you. Did I meet your expectations of today? Did I surpass your expectations? Write it in the chat. Okay, good. All right, at least I helped Dee Dee.
Well, and on that note, I will ask people if they could please take a few minutes to give us an evaluation. I'm going to drop a link into the chat so you can all do that as well.
Good. I'm glad. Yeah, I just don't want anyone. I love giving these talks because I just try to give you as much as my lessons learned and my colleagues' lessons learned as possible, right? We don't need to like all make the same mistakes. And my mentees, I just hand them all of my funded grants and they start with those. And so we have a much higher rate of submissions going to funding than where I started. Thank you. Thank you. Well, I appreciate all of your time. And I hope that even though this was not cancer related, it was still helpful. Dee Dee. Yeah. I try to make myself, so in my academic institution, so it's a great question. So she's asking, how do we pace ourselves so we don't get burned out in this game? I very much plan each year. It's that plan. That's how I don't get burnout, and I try to recycle. I can't write a new proposal and submit it. I can't write a brand new proposal on a brand new topic that's like, and then just do that like multiple times a year. Like if I'm going to go down a new research path, which was my mental health work, and that came 2020 happened, and my clinical research completely got shut down, and a philanthropist came to me and said, suicides are going to be skyrocketed. We need help. We need to write grants. And so that was a brand new one for me in 2020. And that was my sole 2020, was getting that RO1 submitted. It was brand new baby for me. And so that was my goal for October. So in that year, my only goal was to get that RO1 on this new topic submitted in October. Last year, I knew I could turn that grant around. I think I submitted maybe that same grant or a form of it maybe 3 or 4 times in 2021, same with 2022. And this year, I'm kind of beyond that now, and I need to kind of rechange it and reship it out a little bit differently. And so I have a goal to submit 3 this year. One I just submitted, 2 are due in August. So I'll change a little bit of the aims so that if I get both of them, I can keep both of them. I hope that is helpful. So it's that long-term vision of how many do I want, and I want to submit 3 to 5 publications a year. If you get more than that, that's fine, but I usually go with that. Okay. My position is 100% research. Yes, I've worked hard for my 100% research position. That's not easy to come by, but I am at the level now that I can do that. But starting off, yeah, you have to I'm 100% soft money. So I just had to find the money somewhere because I'm a PhD in a school of medicine, non-clinical department of peds, which is, I think out of 1,000 of us, there's like 80 of us that are PhDs, full-time research. Okay. Yeah, and so I do some teaching time, but more mentoring versus clinic to pay the bills, to pay my 100% of my salary. All right, you guys were lovely. Thank you so much.
Thank you, Dr.
All right.
Kaar. We really appreciate your time. This
Of
was
course.
awesome.
Well, thank you. Good. Well, thank you. And I'd love to have any evaluations that you get back so I can make my work better. Yeah, and please reach out if I can do anything further.